My paper on the somatic countertransference asks what happens when the bodies of two people impact on each other, whether in analysis or life. I wrote it after I'd retired from clinical work, but was continuing to supervise and discuss with colleagues their most difficult patients. At the heart of the paper is a patient called Horace, a long-term psychiatric patient who responded immediately to the analytic setting with a primitive language of actions and enactments. He was overwhelming but deeply moving, like the tragic figure of Lear on the storm-lashed heath. Horace developed a severe respiratory symptom, and while working with him, I developed asthma for the first time. An uncanny doubling that I didn't notice or register in any way at the time. And when my dissociation lifted several years later, what was that about? And that's what the paper is written from. There are several famous passages in Jung, mainly from the psychology of the transference, that are foundational to my way of working. For example, when two chemical substances combine, both are altered, and that a sphere of mutual unconsciousness is produced in the countertransference. In the paper, I try to unpack Jung's profound understanding of the analytic relationship. A lot has happened since 1946, and I try to explore some of the psychoanalytic and Jungian analytic work that has gone on since. Now the sensory flaw of our bodily experience would be considered essential and has led to changes in technique. For me, there were three key areas in work with Horace. First, the importance of the sensory level and the need to reclaim the concept of participation mystique and differentiate it from projective identification. Second, the respiratory symptom itself, which I see as a marker and a form of primitive containment of something that was not yet understood. And third, the dissociation in me of the connection between us in the shared respiratory symptom. The unnoticed bodily link, when it did enter my awareness and could be studied, yielded further understanding of what I, and possibly the patient, wanted to forget.